Welcome back. May is National High Blood Pressure and Stroke Awareness Month, and here with us now to talk more about it is Dr. Hughes and Dr. Kendall. Thanks so much for coming in today.
Thank you for having us.
Thank you so much.
Of course. Dr. Kendall, I'll start with you. Tell us why this Awareness Month is so important.
So, stroke is one of the most common disease, and the lifetime risk of a stroke for any individual is almost 25%. 1 out of 4 normal average individual can have a stroke in lifetime. Now, it's very common, but the effect of a stroke is extremely high.
Yes.
It's not only a disease of brain, but it's a disease of livelihood. Anyone who has a stroke, not only it changes that brain, but everything about that person, that family, that society changes. If we look at the number, stroke death rate is one of the highest. So if we look at the total number of death, stroke is number 4 to number 5 cause of death. And in Western New York, it's even higher if we look at all the New York State comparison. Now, disability-wise, it's number 1 cause of disability related to medical diseases. So, extremely dangerous disease, highly disabled, changing the whole livelihood. So that's why it's really important to know the stroke. Now, the other side is it's a preventable disease. 80% of a stroke is preventable. And if we do the right thing in right time, this disease can be prevented. If someone has the disease and if they go to right place, it can be treated. Okay. So 80% preventable, rest treatable, but the things has to be done at time.
Okay.
It's the race against time.
Let's talk about some of the signs of a stroke that we should look out for.
So I usually concentrate on 5 major signs. If there is a new type of headache or increase in intensity of headache, that would be one. Second, any changes in eyesight, either unable to see one side or blurring of vision. Third is change in speech, either slurring of speech or word finding difficulty. Balance change, not able to walk or spinning sensation. And then one-sided weakness or numbness. Whenever any of those, it doesn't have to be all 5, any of those can indicate that there is a stroke going on.
And why is it important to contact emergency services immediately when you're realizing those signs?
Because the time is brain. So every minute we delay the care, 2 million brain cells dies. So we are, as a comprehensive stroke center in Buffalo General, we are trying our best to reduce that time to treatment as much as possible. So that's why we want everyone to use ambulance and go to a stroke center so that we can provide that care as early as possible.
Now, you mentioned that this is preventable. So what should people know about controlling their blood pressure, and how can they recognize when they need medical attention?
Yes, no, as Dr. Kendall had mentioned, it's really important, from a preventative aspect to focus on blood pressure. And normal blood pressure is 120/80. In stages of elevated blood pressure, stage 1 runs from 130 to 139, over 80 to 89, and then over 140/90 is stage 2. So we really want to, focus on the prevention of those elevated blood pressures. And really, it's good communication with your primary care physician. So highly encourage, following up with your primary care physician and provider on a yearly basis. And a part of that is checking blood pressure. So really, there's other community-based organizations that help monitor blood pressure as well. Patients and people can check their blood pressures in their home, but say you don't have your blood pressure cuff and you want to have that check, you can go to the grocery store. There are some units to check your blood pressure there. You can go to a local fire department or also the DMV. So there's a couple different locations. But strongly encourage, if you don't have a primary care physician, that's a really good spot to start, making sure that you're checking once a year. Because it's blood pressure, but how do we manage blood pressure? There's medicine, of course, but it's a lifestyle, lifestyle management. So, working on limiting your salt intake, eating fruits and vegetables, focusing on exercise, stress management. All these are really comprehensive approaches and things that we can discuss in the primary care office, and we're happy to do so.
Nice. Let's talk about the transitional care program and some post-stroke resources that are available for people.
So in Western New York, we have really good comprehensive stroke center. We have Buffalo General, GVI, and we have Mercy. So we do acute care extremely well. but there are things that needs to be done pre-hospital and post-hospital. So transitional care is one part of that post-hospital care. Once someone has a stroke, till the time they see the neurologist as an outpatient or a primary care, we want to support them to navigate the health system so that in their vulnerable time, when they have such a disabling disease, there is a system which can help family as well as the patient to navigate the health system, financial system, and the social system. And that's where this care navigation and transitional care came into.
Alrighty. You've given us some great tips today in bringing awareness about something and also things that people can do immediately to start changing their lifestyle. So thank you so much for coming in. Viewers, if you would like more information on stroke prevention and high blood pressure management, you can visit any of the links on your screen, as well as our sponsor's website at ubmdprimarycare.com. Thanks again for coming in.
Thank you so much.
Thank you so much.